Thank you so much. Welcome, everyone. Grateful for having you join us here today. My name is Joey. As Carrie mentioned, I am a clinical postdoctoral fellow here at Stanford. I'm really excited to talk with you today about using dialectical behavioral therapy, or DBT in short, to navigate chronic pain concerns. Um, so, DBT is a principle-driven therapy. So, my goal for today's presentation is to really share with you some of the underlying models and principles of DBT, and then transition to sharing a basic overview of what the treatment is as an approach, and then give some space to teach and talk through some skills that might be helpful in terms of managing pain. And my hope is that at the end of our time today, you'll gain a broad understanding of what dialectical behavioral therapy is and how it can be applicable to understanding pain, and maybe come away with a few strategies that can be implemented in daily life that would be helpful for your own pain management or your patients. So without further ado, let's dive in. What is pain? Pain is an unpleasant sensory and emotional experience associated with either actual or potential tissue damage. In other words, pain is really your body's warning system and is developed as an evolutionary adaptive response to potential danger so that you can change your behavior in order to protect yourself from that danger. However, the idea of pain can also be reflective of what is a complex distress response that encompasses both a combination of physical and emotional distress. This kind of leans into this idea of the biopsychosocial model of pain, which there have been a lot of wonderful presentation as part of the science lecture series that have done a great job in laying out the different pieces of the model. So in the interest of time, I'm going to shy away from doing this in depth, but I really recommend for folks who want to learn more about this to go through and look through those past recorded videos. In short, though, the biopsychosocial model of pain really highlights this idea that pain is not solely a physical sensation with physical causes, e.g., tissue damage, surgery, etc., but rather that our pain experience is shaped by a combination of biological, psychological, and social factors. Psychotherapy, like dialectical behavioral therapy, might be uniquely suited to be able to address the psychological factors that impact our experiences of pain, such as anxiety, depression, our ability to cope, and pain catastrophizing. With the biopsychosocial model of pain comes an understanding that our experience of pain is a product of maybe many variables that are processed in the brain, and that each of these factors have the capacity to either turn up the dial or turn down the dial of our pain experience. That is the frequency or the intensity of how we experience our pain. Um, and so when individuals experience chronic pain, in other words, not having an acute painful experience in this given moment, it might be because there are some factors that are happening in the context that are either turning up our dial of pain or down our dial of pain that is unbalanced or ineffective that leads to us having a prolonged experience of that pain. Not only might we consider that there are these factors such as fear, worry, anger, stress, sadness that can amplify that experience of pain, it's just to validate that experience of pain is an intrinsically emotional experience. And that over time, studies have shown that negative emotional states become an increasingly prominent feature as folks experience longer durations of pain, with up to 80% of patients reporting comorbid anxiety or depression. Emotions such as worry, fear, pessimism also make us more likely to engage in what we call harm avoidance behaviors. So things like isolating from our environment, which can then also contribute to lowering our quality of life and decreasing our general well-being. Then there's also been, in fact, there have also been studies that show that there's shared brain circuitry between emotional and physical distress, that our experiences of emotional pain are very much mirrored and could be seen as associated with our physical experiences of pain. All of this idea of having a heightened negative emotional state is an indication that we might have some difficulties with emotion regulation, and that these problems with emotion regulation is impacted by our experiences of pain. However, I also want to say the opposite might also be true in that pain can impact our ability to regulate our emotions, or more specifically, impact the way we utilize the way we think, the way we interpret, the way we pay attention to how we are feeling as a way to change or maintain our emotional states. In more simpler terms, pain might actually make it harder for us to be able to change or control our negative emotions because it's being compounded by physiological distress. So, for any of us to be able to generate or experience an emotion, first there must be a situation that prompts us to have that feeling. We have to be able to pay attention to that situation and be able to notice it. And then we have to make an interpretation of it, come up with some sort of understanding about that situation in order to create a response. That response, or how we express that emotion, then contributes into feeding into the next situation that then prompts the cycle again. At each of these different time points, we have the opportunity or the ability to regulate how we feel in that moment. We can choose to select or pay a different situation. We can choose to change the situation that we're in. We can choose to pay attention to this thing or that thing, or choose what we pay attention to. We can choose to change or alter how we're interpreting or making sense of the situation. And we can choose to change our response. As you can imagine, having an experience of pain, intense pain, can really impact each of these steps of emotion regulation and make it more difficult for us to not only figure out how we generate our emotions, but how we regulate those emotions when they do come up. So, DBT, dialectical behavioral therapy, was designed as a treatment for extreme emotion dysregulation. And in this particular treatment, it talks about emotion regulation through a biosocial model, somewhat similar to the biopsychosocial model. And this model posits that a combination of one's biological predisposition to emotion intensity and an invalidating environment that kind of devalues the emotions that are experienced are what lead to an increased likelihood for emotion dysregulation to occur, which I think that we can draw some parallels with how one might develop an experience of pain. So here's some of the parallels that I've kind of put together and think might be applicable. So first, when we talk about that biological predisposition or biological vulnerability, it refers to one's experience of pain in a certain or emotion in a certain way that is influenced by your genetics, brain chemistry, hormones, physiology, etc. Which same can be true with how these biological factors might influence or alter our vulnerability to pain or pain sensitivity. So this biological vulnerability to emotion suggests that for folks that have this sensitivity, they're more likely to have increased sensitivity to having an emotional response, an increased reactivity to that emotion, and a slower return to baseline. So for folks that have high vulnerability to emotions, it might mean that a lot of cues can tend to start that emotion from burning up. A lot of things throughout the day might lead to that emotion to start coming up. That once it starts going, the fire burns really high, the emotion's really intense, and it's really difficult for the emotion to come back to baseline. Similarly, I can imagine with pain, it means with an increased vulnerability to pain perception, you're more likely to identify or recognize pain cues. You're going to have more intense responses to these pain cues, and it's much more difficult for pain to resolve or to recover in the day. That biological vulnerability might not be enough to maintain or perpetuate a high emotional arousal that keeps us sustained. And where that comes in is that invalidation occurs to kind of keep the fire going in some ways. And when we think about invalidation, it really is this idea that it occurs when a person's experience does not match with the communications that others are sharing with us, that others are acting in a way that either demeans, ignores, or kind of oversimplifies the way that we are feeling internally. What this can look like is invalidating your private experiences, not taking them seriously, questioning what you're feeling is true, oversimplifying how you're feeling or the extent of your experiences, oversimplifying how difficult it is for you to actually solve the problem at hand, and also coming up with some degree of punishment of what you're feeling. So, kind of saying that your emotions are actually a burden for other people. With pain, similar language might be coming up. Things like you're not feeling a level 10 pain right now. You should just take some deep breaths. That'll make it go away. It should be over in a minute. or saying things like, your pain is bumming us out, stop making such a big deal out of it. Language around being difficult, not responsive to treatment, being poorly understood, medication seeking, blaming might all be words that are used around to create a sense of invalidation of a pain experience. And so if we were to take some of those building blocks of the biosocial model of DBT and adapt it to chronic pain, we might consider that for a lot of individuals, they have this genetic biological predisposition to certain pain experiences, something that makes it more likely for them to have a heightened experience with pain. That when they experience a triggering event, something like tissue damage or illness or trauma event, that because of this increased vulnerability, it translates more into a sense of chronic pain. And that chronic pain combined with an invalidation leads to that chronic pain experience to continue jacking up, this intensity of pain continuing to increase, which then leads to more experiences and exposure for invalidation, which perpetuates. This cycle of perpetuation could then contribute to increased difficulty with emotion dysregulation, increasing our sensitivity to having those negative emotional states that then sustain our pain cycles. And so all of this is to suggest that maybe a way to address chronic pain could be learning some skills and strategies to help tackle the emotion dysregulation piece. So how does DBT treat dysregulation? When we're holding the biosocial model, it's this idea of really tackling that vulnerability to emotions or the vulnerability to sensitivity or to emotional intensity with a case of invalidation. And here is where we hold somewhat of a dilemma. Because if we were really to focus on altering that sense of invalidation, we might lean really heavily on acceptance, self-compassion, validation, really leaning into this place of like, this really sucks that what you're going through. And if we lean so heavily on the acceptance side, it doesn't actually make what truly is intolerable more tolerable. And nothing really changes in your life. And that we're still kind of stuck in a place of emotional and physical pain. However, if we go so far on the other side, we're really focused on how do we make change happen, go, 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 problem solving. We might end up doing is recreating this invalidating environment and oversimplifying how difficult it is to make the life changes that you need in face of all of the barriers that you're encountering. So what DBT does is we take on a dialectical worldview, this idea that we are complicated beings and entities in and of itself, that we as human beings exist in a system, and that we ourselves are systems. And because we are in a system, we are a system itself, we're complicated, and we're composed of many opposing forces that we cannot be simplified in one way. If we hold this to be true, that means anytime we're holding one thing to be true, there must be an opposite force that must also be true as well. That if we were to hold acceptance, then we must also hold change as true as well. So at its core, this worldview suggests that the tensions and opposites in our lives are constant and inevitable, and that the aim of our work in DBT and in this treatment is to find and balance oppositional truths to create a more holistic and full understanding of reality so we have a fuller base of being able to tackle the challenges around us. The idea that we are able to hold as true, you must accept yourself just as you are, and you have to work as hard and as fast as you can to create the change that you want in your life. Other dialectics that we really would lean into are maybe ideas that you are doing the best that you can in the situation that is given, and you need to do better, try harder, and be more motivated towards improving your life. We also might be holding things like your behaviors and emotions make total sense given the context and the environment and the sensations that you're feeling in your body, and change is needed in order to reduce your suffering and be more effective in these contexts. By holding a dialectical worldview, our mission and our goal is to create some degree of balance and to move away from an either or black and white kind of thinking to a both and to sort of soften the extremes in our thinking, our behaviors, and in our relationships. So, with the dialectics in mind, we have to be able to take this tension and to take this dilemma and move it towards something. DBT is very much a change-based or an action-based treatment. It's very sort of movement-oriented. And so we also hold that it's really, really hard for someone to be happy without a life worth living, without something that they're moving towards. And inherently, all lives are worth living. And there's something that's getting in the way right now that is a barrier to make life feel worth living for you. So, part of the larger question when we enter into DBT is to really be curious about what is it that would make life worth living for you? What is it that's going to carry you through doing the really hard things in life? Even if you were experiencing pain, what would make experiencing pain worth it for you? What would you like to be able to do? What is going to help you carry through doing the hard things to push through the pain? Once we're able to identify that life worth living goal, that becomes a neat, incredible fuel for us to translate into what we call target behaviors. And target behaviors are the steps that we need to take in order for us to be able to move in the direction towards your life worth living. And so we break it down into what we call a treatment hierarchy that focuses on life interfering behaviors, suicide and self-harm being the first one. The idea is if you are not alive and you are not here, then there is no therapy. So our priority will always be to make sure and keep you alive. The next step being therapy interfering behaviors. What are the things that are getting in the way of you getting the full dose of what this treatment can offer? So, for example, if the pain is so unbearable and you're having a hard time getting out of bed, we might treat that as a therapy interfering behavior and figure out a way how we can navigate and problem solve around more consistent attendance and therapy. Um, and lastly, we have quality of life interfering behaviors. These are things like anxiety, depression, insomnia, movement related goals, anything that might be captured within barriers to get you closer to your life worth living. And so we focus our treatment to be based on this hierarchy of targets and what we address first and foremost. So knowing that that's kind of like the function and the background of DBT, I'm going to transition us to talk a little bit about the nuts and bolts of what is the structure of the treatment in case you're ever interested. So the structure of dialectical behavioral therapy can be broken down into four different modules and can be offered in different configurations. However, the more traditional form of DBT, or what we call comprehensive DBT, is composed of four components. And the structure of this program is dictated by what is most important and what is needed, and each of these modules focus on a different function. If you were to enroll and commit to a year-long course of, or if you're to commit to comprehensive DBT, you'll be committing to a year-long course of outpatient psychotherapy where you are committing to doing whatever it takes to move towards your life worth living goal. You are committing to doing whatever it takes to take on those change-based strategies to start building your building blocks towards creating that life worth living for yourself. And so how we do that is that first we have individual therapy as part of one of your four modules. The individual therapy is really oriented towards pulling patients towards building new behaviors, identifying what your specific targets are, looking at the unique circumstances that are bringing them that might be getting them in the way of going to their targets. What are ways that we can bring them closer to improvement, and integrating a lot of what they might be learning in skills group, which I'll talk about later, into their individual goals. Individual therapy is like a weekly session once a week for about 50 to 50 minutes. Then, in addition to individual therapy, we also have phone consultations, which is a way for us to have access, for patients to have access to their individual therapists outside of their one-on-one sessions so that they can generalize skills learning and learning these changes to targets in their real world context. So they're not on their own to do that. Then they also are committing to skills group, which is something that I'll go into a little bit more in detail. But this is essentially a class for emotion regulation and skills on how to be effective with other people. And then lastly, your therapist is also committing to a consult team, which essentially is a way to enhance your therapist's capabilities and motivations and give you more additional support. So all of these components are offered as part of comprehensive DBT, but what I want to focus in on is a little bit more on skills group and talking more about how some of these skills could be applicable to your own individual pain management or recommendations that you can have for pain management. So as I mentioned, DBT Skills Group is not meant to be a process group. It is very much an educational group. It is meant to be like a class that teaches you the ABCs and building blocks of how to regulate your emotions and how to tolerate distress and discomfort. Um, and so there are 4 skills that are taught on a rotating basis. Mindfulness starts for the first 2 weeks of the module, then it goes to distress tolerance, emotion regulation, and interpersonal effectiveness. Typically, for folks, they can do all 4 modules over the course of 6 months, and they do it twice in the year-long period, but there are also some groups that do it within the whole year. Here at Stanford, we offer them in 3-month chunks, and you can do all 4 modules over the course of a year. So what I'm going to do now is I'm going to talk about each of these 4 modules and hopefully do a little bit of a brief overview of what the module is about, as well as a skill that could be helpful within that module, um, as a way to kind of give you a little bit of a taster of what can be offered and for you to consider if you have anyone that would benefit from being in any of these modules for skills group. Um, okay, so mindfulness. Mindfulness, I would say, is probably one of the core skills that we learn in dialectical behavioral therapy. That regardless of what module you're in and what skills you might be oriented in each of in and out of group therapy or individual therapy, it's going to be anchored on this ability to have non-judgmental awareness of the present. And the idea behind mindfulness is that in order for us to actually be able to regulate, control, or change our emotion, we have to have the ability to know what we're paying attention to and to be able to modulate what we're paying attention to. So, and mind without mindfulness, without awareness of the present, might actually get pulled in all sorts of these directions, pulling from sights, sounds to what's in our environment to then our internal interpretation of those thoughts. Our attention might bounce around in a really quick way that feels very unwieldy and out of control. With a lot of pain experiences, you might start noticing your thoughts kind of swooping around the sensation towards your feelings, towards your thoughts, and kind of going in that cycle, keeping you really caught in a way that's like not able to control where your mind is going. You could also stay really stuck on focusing and ruminating on the sensations that you're feeling in your body, which also isn't necessarily helpful for being in the moment. And so, mindfulness, the idea of having non-judgmental attention, is an idea of building this capacity and strategy to hold your mind still and allow for stimuli to come in and out of your mind as it goes. And the goals for doing mindfulness is so that you can build your capacity for general stress relief, reduce your suffering, increase happiness, increase control over your mind rather than letting it take control of you, which means you have an increased ability to reduce the cognitive or emotional dials that turn up or down your pain, as well as helping you learn how to accept the reality and experience reality as it is with a more accepting and validating kind of mindset. And so when we talk about mindfulness skills, particularly the how skill, we're talking about doing mindfulness in a way that is non-judgmental, seeing things as they are, but not evaluating them as good or bad, using that as a moment to acknowledge your values, your wishes, your reactions, noticing the difference between what is helpful and what is harmful. We ask that folks practice mindfulness one mindfully, so one thing at a time and anchoring yourself in the present, and also to really focus on what works rather than getting stuck on the things that are not working or that being willful about why are things not the way that we want them to be. As I go through each module with each of these slides and skills, I put in a little link here that you can reference on the slide that takes you to free resources on accessing all of the handouts, as well as give you a reference for what handout I am referring to when I'm talking about the specific skill. So I want to invite you all to give a mindfulness practice a try. So for the next minute, I'm just going to hold us to practice what I might be a mindfulness practice called puppy mind. And so the steps are, I'm going to ask you to choose an object of focus, whether that's this presentation or whether that's something in your purview. Hopefully it's this presentation. But as you're focusing on this presentation, I want you to notice when your mind wanders away. Start noticing if and describing what is it that's pulling your attention away. I'm thinking about what I want to have for dinner. I'm noticing a sensation or a twinge on my left shoulder. I'm noticing that I'm starting to have some sensations in my hands that I don't really quite understand. When your mind wanders, just notice and describe what it is in as non-judgmental of a way as possible. Accept without judgment that your mind has wandered. Just kind of give yourself a little bit grace and say, like, my mind is a puppy, and that's okay. It's just wandering off and doing a thing like its puppy does. Once you acknowledge that, refocus your attention back with the object of focus and to refocus your attention with an attitude of some degree of self-compassion and empowerment. I am capable of training my puppy mind to focus on the thing that I need to. So this doesn't take very long. You can do it for a minimum of a minute. You can do it for longer. But I ask that as we go through the rest of this presentation, see if you can notice and try to engage a little bit in puppy mind. If you notice yourself wandering away from our presentation, that's totally okay. Notice it, observe it, describe it non-judgmentally. Allow yourself to acknowledge that it's okay for your mind to wander and tell yourself you're capable of training your mind to focus on the thing that you want to focus on. Okay, so that's mindfulness. Transitioning to the next module, which is distress tolerance. This is often a module that a lot of folks think about when they think about dialectical behavioral therapy, because it's a lot about skills of how do we take someone from a 10 out of 10 down to maybe like a 6 or a 7 or a 6, or even down to a 5. What I want to clarify here, though, for distress tolerance is what is a crisis, because it's important to distinguish what is a crisis versus what is just long-term general discomfort that I'm sitting in. So when we're thinking about a crisis, this has to be something that is a serious problem that you cannot solve right now. So something is jacking up that emotional intensity in a way that needs to be solved because something is important, but I don't know what to do with it right now. And the emotions are so high and the problems are so distressing that if I were to stay in this high emotional intensity state, I am going to have the capability of making the situation much worse for myself. And because the emotions are so high and the problem is so distressing, there feels like there's an intense internal pressure building up to solve the problem right here, right now. And so, again, if we feed into that urge of doing something to solve the problem right here, right now, we might not actually do the thing that is best for it in the long term and accidentally make the situation worse. The key here, too, of thinking about a crisis is that it really is intended to be a short-term solution. If this is something happening all the time, it might be a crisis in the moment, but we would want to orient our problem solving towards creating a more longer term coping plan on how you can navigate the crisis and solve the things that are making the crisis come up all the time. So when it comes to distress tolerance, these are all skills and strategies that are meant to, A, help time pass so you don't ruin and screw up the situation more for yourself. It's also intended to increase your ability to sit and tolerate this moment in distress, to sit with this discomfort, and to transition your mindset from telling yourself, I can't stand this, I need to do something about this, to a stance of this is hard and I will get through it. I believe that I can get through hard things. A secondary outcome of using distress tolerance skills might be that you end up feeling better, but that truly is not the primary goal. The primary goal of using distress tolerance skills is how to make sure you can get through the moment without making things worse for yourself. So one of the skills that I really like to use with a lot of my folks that have pain is this idea of using self-soothe, which is to do anything that you can to make this current experience feel more pleasant, comforting, nurturing, peacemaking, gentle, kind to your body and your sensations and your experiences, because it's much easier to pass time when you're feeling as comfortable as you can be. Noticing that in this given moment, there might not be a lot of things that you can do to make the pain go away. So, how can you create an environment as best as you can to make the experience as pleasant as possible, even though acknowledging that it doesn't feel great? And so, part of using self soothe is actually anchored on our five senses to use our sight, our hearing, our smell, our taste, and our touch to create an environment that makes us feel a little bit more comfort and a little bit more cared for. So on the slide, I have some examples of things that folks have used as self-soothe techniques. If you were to click on the link and reference handout 8, the self-soothe handout has a bunch of ideas of things that different folks have tried. So really take a moment, look through the list, see if there's anything that jives with you, or if you kind of would want to figure out like what does help with your pain, what doesn't help with your pain. Okay, so kind of in the contrast of more of the short-term crisis type skills that we might for distress tolerance, emotion regulation comes on the other side of the dialectic, which is all about how do we change the way that we feel? Not about how do we sit with how we feel and get through a tough moment, but how can we actually change our situation, our attention, our interpretation, or our experience of it so that we can problem solve that emotion a little bit more for the long term. So, at the core, our emotion regulation strategies really are focused on understanding our emotion, being able to accurately label and gain awareness and communicate what that emotion is and what function it serves, and why we might choose to respond in particular ways when we experience emotions. To reduce our overall vulnerability to emotions, so increase our capacity for having positive emotions and decreasing our vulnerability to negative emotions, learning ways to change our emotional responses, and then generally using a lot of these skills to decrease that overall emotional suffering, the ability to let go of having really painful emotions and not getting caught in them. And so I really like to reference folks to anyone, actually, what I call the dictionary of emotions in emotion regulation handouts. And this is essentially emotion regulation handout 6 are pages of descriptions and explanations of specific emotions that are broken down into different categories. And by using this, you can reference and start to build an index or an inventory of what comes up for you when you are experiencing a particular emotion. So you have a better understanding and awareness of what are emotional states for you. So, first of all, we might look at prompting events. For every specific emotion, there are typical prompting events that set up that emotion, typical situations that are associated with that emotion. And so, kind of understanding what that could be can lead you to have a better awareness of what that emotion is for you. Every specific emotion has typical vulnerabilities around it, but also typical um, interpretations, thoughts, assumptions that are associated with that emotion that can prompt that emotion to come up based on the event that's happening. That you also have typical biological changes and experiences, feelings, body sensations, actions, action urges that come up when it comes to particular emotions coming up in yourself, that we all have expressions and actions that are typically associated with each emotion. So things are like our facial expressions, our body language, how we communicate, what actions are associated. We have to remember that every emotion that we have actually serves some degree of a primary function. And that primary function often is to elicit action in order to solve a particular problem. So understanding what that expression is, understanding what that urge is, can give us a better understanding of like, is this emotion actually the best way for me to solve the problem that I have in front of me? And then lastly, understanding that every emotion also has after effects of what its impacts are on your mind, your body, and the emotions that you have after you have that first initial experience of the emotion. So building up, using these handouts to build up your vocabulary and your own understanding of your emotional states. And last of the 4 modules is interpersonal effectiveness, which I kind of really appreciate as the skill that is taking in all of the skills that you would learn through mindfulness, through distress tolerance, and emotion regulation to increase your capacity to be more effective in social environments. Because oftentimes, when our emotions are heightened, when we are feeling more dysregulated, it's much more difficult for us to actually be able to communicate with other people what we need, and therefore increases our ability to be invalidated in our own experiences. So the whole goal of interpersonal effectiveness is learning how to be effective and being able to ask other people to do things that we want them to do, saying no to unwanted requests and being able to set boundaries for things that we don't want, building relationships, strengthening current relationship, and ending destructive ones. So not letting hurt or problems build up and creating resentment or more hurt. Repairing relationship or ending ones if necessary, so that we can also kind of repair from those pain points. Resolving conflicts before they become too overwhelming. And lastly, actually learning how to what we call walk the middle path, which is if we're unable to get validation and support from other people in our environment, learning and building up our own capacity to self-validate so we can lessen the blow that we would get from our invalidating environment. And so when it comes to interpersonal effectiveness, there are different skills for different scenarios. One that I like to really use and that I think is a framework that can be helpful for a lot of folks being more effective in asking for what they need or saying no to what they need to say no to is called Dear Man. And this is a skill really oriented towards getting you what you want, especially if you have a specific goal in mind. So before you approach a dear man, I would recommend kind of really asking yourself this question: what is a specific result or change do I want from this interaction? What am I hoping to get out of the other person? And examples of this are kind of questions and saying like, I want them to do this for me. I want them to stop doing this. I want them to commit to this, to agree to this, or to understand this. When you create your objective and you create your goal for that interaction, you want to be as specific as possible. And the clearer you are about your ask, the more likely it is that you can get what you want. So once you have your objective in mind and knowing what it is that you're looking for, then you walk through the steps of your Dear Man. So the D stands for describing the problem as factually as you can without judgment. So using clear, concrete terms to describe the situation in a way that you and the person that you're making the request with can both agree to, that both of you are seeing the same thing and hold as being true. The E comes in as it stands in for express. So expressing your feelings about the situation using I statements. When you canceled our appointment, it made me feel really anxious because I didn't know when my next appointment was going to be. Really highlighting how the situation is linked with how you're feeling. A stands for assert. This is where you actually get to make your request. So being really, really clear about what you want and how that's linked with the way you're expressing. So I would like for us to schedule an appointment before the end of our time today, something like that. And the R, which is, I think, the most important part of the Dear Man that oftentimes we forget, is giving our little bit of reinforcement, kind of highlighting to the person that we're making the request to why this request is also in their best benefit, right? So not only does it help alleviate your anxiety, but what does it do for them if they meet your request? And so if you're able to create a very concise Dear, it is more likely for you to actually be able to accurately express what it is that you're hoping to get. The man part of the Dear Man is about how you want to say it. So when we say about being mindful, be very focused and laser focused on your objective. Don't sway. Don't get sidetracked by any sort of insults or any other questions. Kind of really stay focused on what it is that you're hoping to get out of the situation. Appear confident, appear assertive. Consider your body language, your tone, your posture, your eye contact. Really appear like you know what you're talking about and you kind of like feel confident in that. Be willing to negotiate. Recognize that not everyone can give you exactly what you're asking for in that moment all at once. So, where are your concessions that you're willing to make? What are the steps that you're willing to take to kind of work up to that point? Is there a piece that you can commit to now and do a later Dear Man later down on the line? So, some of these things that you want to work through and be willing to work with the other person as you're trying to get your objectives met. So, I basically ran through skills that would each take about an hour to cover in the span of 15 minutes. So I'm sure there are a lot more details that I could go into and would be helpful. However, I wanted to give everyone a brief snapshot on what you can expect from DBT skills and what they might be helpful for in the different contexts. For some additional resources, here are some books and websites and apps that I always like to recommend for folks who are interested in DBT. The Green Book is sort of a self-help book to walk you through all the DBT skills. Miracle of Mindfulness is one a book that I highly recommend for anyone who's interested in learning about mindfulness and from the beginning level. Building a Life Worth Living is the memoir from Dr. Marsha Linehan, who is the creator of dialectical behavioral therapy and really shares and highlights a lot of her ethos behind creating the treatment. Here are links to a bunch of websites that have free handouts and skills and explanations of these skills, as well as these two are apps that you can find in any of your app stores. Just type in DBT and they'll pop up. I call them the purple brain and the blue brain. Each of these have ways to track your skillfulness, your target behaviors, as well as giving some resources on how to practice the skills themselves. And last but not least, here are some resources for getting connected with either DBT at Stanford or outside. So we have your pain psychology classes, and if you're interested in pursuing DBT here at Stanford, you have the option of joining just the DBT skills group and learning the sort of skills-based modules. If you were to do that, you would have to have an individual therapist outside of the comprehensive DBT program, or there's also an option of joining the comprehensive DBT program. Here on this side is a list of community DBT resources and other places that offer comprehensive DBT or DBT skills group. And I'll transition a lot of the pain education and support resources back to my colleagues who might know a little bit more than I do. But that's sort of all I have. Thank you so much for listening, and I'm happy to answer any questions.